to shock management. So shock is defined as a lack of adequate supply of oxygen to the body tissues. Shock can range from mild to severe, including collapse, coma, and even death. There are numerous causes for shock in animals, including injury, poison, infection, exposure to the elements, and it can be a secondary symptom to existing problems or emergencies that the pet is experiencing. So the first part of our protocol is that we're going to restrain and muzzle the pet if needed. We're going to place the pet on its head, on its side, with its head extended. This is to make sure that they have access to a nice open airway with the nose extended away from the body and chest. And then if we can, we're going to elevate the back end of the pet a little bit higher and put blankets or towels underneath. Another note for shock is that when a dog is experiencing shock, they're not going to be able to regulate their own body temperature very well. So we need to do that for them, make sure they don't get too hot or cold. So say if you're outdoors, if the pavement's super hot, you want to put something under them, or if they're feeling too cool to the touch in their shock, we're going to cover them with blankets and keep them nice and warm. We're elevating the back end in order to give the heart a little bit of help. If the heart doesn't have to work so hard, it's going to help alleviate some of the symptoms of shock. The other thing that we might do is make sure when we extend the head that the tongue is just pulled free of the back of the throat and not in the way to obstruct any breathing. Do not give the pet anything to eat or drink when they're in shock. And keep a check on capillary refill, which we discussed previously. We're putting pressure on the gum area to see how quickly the blood flows back into that area. Other symptoms can be weak and rapid and shallow breaths. Sometimes we refer to this as thready in the pulse. So it's going to be a very quick pulse, but it's going to feel very weak. So instead of like bum, 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 it's going to be like because the heart is trying to work faster to do its job because it's failing, but it's not going to get a lot done in each beat. So it's going to go very quickly and very shallowly. Okay, let's move into fractures and limb injuries. So multiple injuries to the skeletal system, including bone, joints, ligaments, are common in all types of major accidents and trauma. A dislocation is an injury to the capsule and ligament of the joint and results in displacement of a bone or joint at the joint. A sprain is an injury in a joint, ligament, or muscle. The muscle or tendon in the region around the joint, and a sprain is an injury to the muscle that results from overstretching. Fractures can be caused by motor vehicle accidents, falls, trauma related to recreation, exercise, or even blunt force. There are two types of bone fractures, simple and compound. A simple is when the broken bone does not puncture the skin, and the compound is when the broken bone fracture does come through the skin. You're going to see signs and symptoms of limping, favoring one limb over another, or obvious pain in an extremity or tail. And so our protocol for broken or injured limbs is going to be to first, of course, restrain and muzzle the pet if needed. Special care should be taken when handling a pet with this type of injury. The general rule of thumb is any pet in pain or moved into pain can and will bite. So extra special care in this instance to make sure you're keeping yourself safe and the animals around you safe. In the process of splinting that limb, you may move it and move the pet into pain, and they may retaliate accordingly. The next thing that we're going to do is immobilize the limb as it is found. So meaning we're not going to move it from the position you find it in. You risk damaging more tissue, moving any broken limb or even a strain or muscle pull that way. So however we find the limb is how we're going to do it. We're going to find a hard, straight object. I have in your first aid kits a couple of options size-wise for this. And for this particular dog, we're going to pick the larger one. And if this front leg is the one we're going to immobilize, we're going to put it down the length of the leg, gently set it there, and then we're going to take our gauze and we're going to start at the top above the injury and start wrapping that splint in place. Be careful not to over tighten. You may, again, move the injured limb by over tightening it, and we don't want to cut off circulation, what little there may be there if there is a broken bone or an injury like that. And we're just going to gently wrap that splint into place. You can even take the extra step of tying off so that it stays in place. And I always, if I have extra on the end of my roll, I'll just tuck it under like that so it stays in place and we're ready to transport. At this point, we're ready to transport to the animal hospital. We're going to try to alleviate movement as much as possible, and we may need to be ready to treat the pet for shock from this injury. All right, our next thing is going to be poisoning. So poisons can be liquid, solid, or gas, and it's anything that can cause harm or death when ingested, inhaled, absorbed, or injected into the pet. Dogs are 4 times more likely to be poisoned due to their curious nature. They really like to investigate everything and stick their faces in places, so they're a lot more likely to be victims of poisoning. Careless handling and storage of potentially toxic substances can lead to poisoning. This is why we're really big in our salons on labeling all of our cleaning supplies and products that we use really well as keeping them in places where pets can't access them to chew on them or ingest them. Garbage poisoning is a really big one in the United States, and it's something we can see easily if they ate out of the garbage at home and then were immediately dropped off their appointment with us. So be aware that a poisoning could occur before you're in possession of the pet, and watch for the signs and symptoms of that. Staph bacteria is often found in the garbage, and that's going to present with signs of vomiting, diarrhea, excessive salivation, breathing difficulties, excitability, loss of consciousness, and sometimes even seizures. They may also present with an elevated heart rate and breathing at first, but that can quickly decline into too slow of heartbeat and breathing, and even unconsciousness and death. So when we encounter these signs and symptoms and suspect poisoning, we want to try to determine the substance of the poisoning if at all possible, and if we can, we're going to take the packaging with us to the vet when we transport the vet to give the vet the best chance to find out what they've been poisoned with to treat accordingly. And it also, if they vomit, take some of the vomit with you to the vet. Poop bag is fine because you can just put your hand in the poop bag, scoop it up, tie it off, take it with you. That way they can test that if need be, especially if you didn't witness what the substance was that they were poisoned with. And then, of course, we're going to contact the vet or an emergency center. For any pre-hospital care, they're going to tell you to do. We're going to go back to earlier I said we do not induce vomiting unless specifically told to do so by a vet, or in this case, animal poison control. And we do have access to the ASPCA Animal Poison Control Hotline if we can't get a hold of a vet. The number is there in your packets, and it should be posted in your salons. If we can't get a hold of a vet immediately, that is another option. They do charge with a credit card over the phone, but it's kind of our only resource when we can't reach a vet. And they do as many follow-up calls as necessary. And I've even had them find a vet close to me that's able to take the pet immediately on an emergency basis and set it up for me to just go directly there between me and the vet on another line.